Hi, I'm Alicia. I'm going to talk to you today about narcolepsy. So, what is narcolepsy? The Mayo Clinic said that it usually is diagnosed around the ages of 10 to 30, which is a wide range. According to the National Institute of Neurological Disorders and Stroke, it affects the brain's ability to control sleep and wake cycles. Those cycles become blurred. And the REM cycle, which automatically makes our muscles go limp, then when people experience this, it can happen when they're awake, and so it interferes with their emotional well-being, their social interactions, their ability to think clearly, and that can affect their work, it can affect their school, etc. The most typical symptoms are excessive daytime sleepiness, something called cataplexy, which is a sudden episode of muscle weakness that can be brought on by really strong emotions. Even laughter sometimes can bring this on. Sleep paralysis, when you go to sleep and when you wake up, not being able to move your muscles for a little bit. Definitely fragmented nighttime sleep, and the REM sleep behavior disorder that was mentioned earlier. The effects of this on families and the implications for counseling. According to Jenham and others of 2012, there's significantly higher doctor visits and medication use. There are lower employment rates and lower income levels, unfortunately. The socioeconomic consequences may present years prior to the diagnosis of the disease because there is so many challenges in the diagnosis. Shockman 2022 said there's limited support for families, especially mothers, and a lot of times they will know something is wrong but not be able to figure out what it is, and so it takes a little while to get that diagnosed. There's an adverse psychological effect on the whole family. In NICRG of 2017, there's negative impact on functioning and mental health, depression, anxiety, difficulties in work, school, family relationships. They've found that there's more enthusiasm now for support groups, CBT, and there's also mindfulness that's aimed at emotional and psychosocial improvement. Some of the potential treatment options are advocacy for the patient, strong, really huge need for that, support groups, marital counseling for the parents, and also family counseling. Schuling in 2023 said mindfulness can also reduce the hypersomnia symptoms for patients, which makes me think of spirituality and how one can cope with a neurological condition using that. And according to Chambers Richards and others, those who had spiritual values had a much higher satisfaction in their lives than those who didn't. And it went a step further to say that those who had participated in religious services regularly had even higher quality of life. Could be because of the social aspect of that. There is a need for a more multi-pronged approach, including practitioners that can be trained to meet the spiritual and religious needs of clients. It reminds me that we are living in a fallen world, and one of the consequences of sin entering the world is that work will be hard and relationships will be hard. We found that in Genesis 3. When we have a heart that's focused on the purposes of God and knowing that suffering in the world is to be expected, we can remember that the sufferings of this present time are not worth comparing with the glory that is to be revealed in us, as the Bible says in Romans 8:18. It also allows us to trust that suffering produces endurance, endurance produces character, and character produces hope, as found in Romans 5:3-4. And I think that's just an encouragement of having that hope that we need when you're facing something hard. It can help on many different levels, and even those who are struggling with a neurological condition. So thank you for listening. Have a great day.